wants to be a nurse practitioner, but not everybody wants to get the bedside experience. There are 5 things you need to master at the bedside before you ever write an order as a nurse practitioner, because grad school will not teach you any of this. Number 1, make sure you know how to recognize rapid deterioration. Recognizing when a patient is deteriorating before the numbers tell you is the hardest skill to teach because it comes with experience. It's not mysticism or something like that. It's pattern recognition. And that is built by what? Repetitive exposure to actual patients. We are the continuous surveillance system of our patients. Number 2, actually learning how to do a physical assessment. There's a gap between what we're taught in nursing school and what we actually apply in practice. And how do I know that? Evidence. There was a survey of 434 acute care nurses. It found that the actual skills or measurements that acute care nurses used at the bedside were temperature, oxygen saturation, blood pressure, breathing effort, skin, and mental status. That is such a small piece of the puzzle. Only 7.2% of nursing time is used for performing an actual physical assessment. The nurse that actually disciplined themselves to do a thorough assessment, those are the nurses who walk into an NP role knowing exactly what they are talking about. None of that is going to be crammed into your head in NP school. Number 3, actually knowing what the medications that you're giving are doing. When I was on the bedside, I made sure that if I ever came across a medication that I didn't know, I would look it up and commit that to memory. There are new and evolving medications every time we turn around. I guess we should stop turning around. Biggest knowledge gap for nurses was mechanism of action. Why don't you know how the medications that you're giving actually are working in the patient's body? That's being taught to us. The bedside is where pharmacology becomes real. Watching a blood pressure respond to vasopressors, seeing a patient's respiratory rate change after opioid administration. And that's the type of experience and reasoning that you need before you start prescribing medication. Number 4, giving a handout that actually protects the patient. What information is pertinent? Not all this hoopla, she say, they said. Communication failures are implications in about 70% of sentinel events. Ineffective handoffs occur approximately 19 to 31% of the time. A structured handoff significantly reduced medical errors and preventable adverse events. If you know how to give a good report, that directly correlates with how good of a nurse practitioner you'll be, because you know how to prioritize and you know what's important. And number 5, managing the chaos. Prioritization under pressure, especially in the acute care and surgery world, where I work as a trauma and a general surgery nurse practitioner. No graduate or NP program can accurately simulate a patient that's crashing when the family member is at the bedside demanding that you give them answers. Clinical prioritization is knowing who's the sickest patient, and you build that through years of experience at the bedside. Or when you become a nurse practitioner, you will fill the gap immediately. What's a commonality in all of these things? All 5 of these skills are built through repetitiveness and exposure. What do you need to do before you go to nurse practitioner school? You need to be a nurse first. I know that's not the answer you want to hear, but it's the safest thing to do, and it's what's most important. If you don't know me, hi, I'm Ken. I'm a trauma and general surgery nurse practitioner. Follow me for more if you want to be a trauma or surgical nurse practitioner.